All right. Good evening, ladies and gentlemen, and welcome to our first annual Advocacy 101 webinar. I want to thank you for joining us. I know it is going to be a fun-filled evening full of education on some of the big pressing issues that we're facing as student dentists, and eventually we'll be facing as dentists as well. This evening, you will be allowed to ask questions. Oh, why won't this not expand? Sorry, is that full screen for y'all? Well, I don't know what's going on. You will be able to ask questions. If you type into the chat box in the very bottom right, you will see a little area where you can type your questions. All the questions will be answered at the end of the webinar in the order that they are received. This evening, we have really great panelists. My name is John Vogel. I am the chair of the Advocacy Council for ASDA. And with me are Kyle Lantz from Colorado, a fourth year, Emma Roy, a fourth year from Marquette, and Stephen Erbeck, a second year from NYU. They are all legislative coordinators and sit on the Council of Advocacy and will be presenting on various topics this evening. So I hope y'all are ready to begin and ready to get educated. First off will be Kyle Lantz presenting on why advocacy.
Kyle, if you could turn yourself off mute.
To turn the mic on, yeah. Let's do that. Yeah, so advocacy is definitely one of my favorite quotes by Thomas Jefferson. We in America do not have government by the majority. We have government by the majority who participate. And I think this just speaks to why all students, and then when we become dentists, why we should all be involved. Because things don't happen in government, things don't get passed unless we actually speak out and, try and affect change. And that's basically the definition of advocacy. And then this is just the mission statement for ASDA here, which you can read there, just that ASDA is a national student-run organization, protects and advances the rights, interests, and welfare of dental students. And I think that sentence, that first sentence there in the mission statement, is just really evident that advocacy is a really important part in doing so, because by meeting with legislators, by being involved and knowing what's going on, we can really affect change that will help our profession in the future. And this next slide here is just kind of an overview of how ASDA is set up. So at the top you have National ASDA, which is the Council on Advocacy. That's kind of, so the three of us sit on, and John is the chair. And then District ASDA kind of sits under that, and then Local ASDA is under that. And then within each subset you have, different positions at the local level at your school, and then you can work with other schools at the district level, and then on up to the national level. And I like this chart here just because it kind of shows, how all of us are kind of working together to stay informed and help each other out with whatever it is, whether it's advocacy or whatever else you're doing within ASDA. And here's just a quick picture of this year's 2017-2018 Council on Advocacy. There's John, fourth from the left, and then Tanya Sue, our national president, and then Stephen, Emma, and myself right there as we move to the right.
So we also wanted to introduce ADPAC to you tonight. And what it is it stands for the American Dental Political Action Committee. And most interest groups have a political action committee that represent them. So the American Dental Association is associated with ADPAC. We call ourselves the Tooth Party, so we're completely bipartisan. They work on both sides of the aisle. They work for laws and bills that are both Republican supported and Democrat supported. And they work with legislators who are kind of all over the board as far as their political affiliations. They really work for us in Washington, D.C. when we're not able to be there. So they're the ones who are lobbying on Capitol Hill every day. They're the ones who are educating our congressmen and women on dental issues, because a lot of them don't have a lot of information about the issues that affect dentists and students and patients. But really are people on the ground and working for us and for our profession. It's a really great way to become involved in advocacy in an easy way. As a student, your membership fee annually is only $5. That increases as you're a dentist, but it's a great place to start to become involved in advocacy and a thing to continue throughout your profession. So I'd encourage all of you to consider joining AdPAC as a way to support your profession in the legislature.
All right, so moving on to the issues. The three major issues that ASDA is concerned about right now is licensure reform, mid-level providers, and dental student debt. There are obviously others, and we'll talk about a couple other ones too at the end, but these are the three main ones right now. So licensure reform. So ASDA currently believes that licensure right now is not great, and that an ideal licensure exam does not use human subjects. It is psychometrically valid and reliable in its assessment, is reflective of the scope of current dental practice, and is universally accepted. And so just a few details on that. So current exams, as you know, you have credits, REB, ADEX, and among others. And you have to do procedures, irreversible procedures on live patients. And then as far as scope of practice goes, you're only doing a couple of restorations, a quad of SRP, if the state even requires it, because some states don't even require the perio section, and then a little bit of endo. And so ASDA believes that it should include, some treatment planning, pros, and different other things that a dentist will do in everyday practice. And then currently, you can't just take one exam and go to any state. For example, if you want to go to Alaska, you have to take REB. But if you want to go to Hawaii, then you have to take ADEX, and you can't take REB. And then Wyoming, you can take any exam, but you have to take PROS. So there's a lot of variables right now, and it makes it much more complex when trying to get a license. And then just trying to move around state to state is not easy. So currently, ASDA recommends, they believe that a kinesthetic and clinical decision-making competence should be demonstrated through a mannequin-based kinesthetic assessment. So that would be your hand skills and everything like that, but not on a patient. And then non-patient OSCE examination, and that's the current Canadian model, and certain other states are testing that out. I know currently Colorado, where I'm at, is accepting that as a pathway to licensure. And then submission of a portfolio of comprehensive patient care. So seeing a patient, through school, instead of just, a one-shot high-stakes exam, which is what it is right now. And so if you haven't heard, ASDA published the white paper back in October of 2016. And so that addressed issues with validity, reliability, and ethics in the current licensure process. And just a few details on that. Validity is just basically that everyone will agree on what the results of the exam mean. Reliability is that the exam will be scored similarly by different people at different times. And then the ethics, which I've already kind of touched on, the live patient exam. And if you fail one of these exams, that basically means that your restoration was not up to the standard of care, which means the patient received substandard care. And then a lot of times these patients are not receiving follow-up care because you're kind of just seeing them for the exam, and then it's tough to follow these patients and make sure that they're keeping up afterwards.
Okay, so the next subject that we wanted to talk about is mid-level providers. And I know there's a lot of confusion about what exactly a mid-level provider is, so hopefully I can clarify a little bit of that for you tonight. There's lots of different versions of mid-level providers, but tonight I'll be talking specifically about those in terms of dental therapists. It's someone on the dental team who's in between a hygienist and a dentist as far as what procedures they're allowed to do. It depends state by state as to what they are allowed to do, but often it involves irreversible procedures on patients, things like simple cavity preps and fillings, sometimes simple extractions. And like I said, that varies state by state as far as what their legislation allows. They've been around actually for quite a while. 2004 was the first time that mid-level providers were introduced in the United States, and that was in Alaska. And they were really introduced as a way to solve the access to care issue. Alaska especially has a large rural area of the state, and there's not a lot of people there, which would mean it's hard for a dentist to survive there, and not many dentists want to go practice in those rural areas. So they came up with the mid-level provider as a way to help provide care to those areas at maybe a less expensive cost, or able to cover a broader area of population. Usually they have quite a bit less schooling than dentists. It depends again on the state, but often it's around 2 years of education. And like I said, they're able to perform irreversible procedures on patients. In 2009, Minnesota also allowed licensing of dental therapists, and since then Maine and Vermont have also allowed them, and they're able to be used for Native American tribes only in Oregon and Washington State. So what does ASDA believe on mid-level providers? We believe that only a qualified dentist should be able to perform certain duties, which include exams, diagnosis, prescriptions, and those irreversible dental procedures. We believe that dentists are the ones who are qualified for those, and people with quite a bit less education than dentists really shouldn't be performing these procedures, especially state by state. It varies on how much supervision these mid-level providers receive. And in some cases it's very little or even remote supervision, and that's something that ASDA does not believe is best for patients. So what can you do about this? We have more information on our website and on ASDA Engage about mid-level providers, and it's consistently being brought up in new states. More and more states are having legislation introduced to approve mid-level providers, and there's a lot of organizations that are pushing for them as a way to fight barriers to dental care. So you can keep yourself informed on the issues and up to date on where that current legislation is being initiated. There's often information on it in our monthly newsletter, the Advocacy Brief, which you get emailed to you. So really just staying up to date on what they are and where they're being introduced is the best way that you can help with that cause.
All right. Hey guys, I'm Steven, and I'm going to talk to you a little bit about student debt here. So now that I've got that pulled up, I'm going to go through a nice infographic that ASDA has so wonderfully provided for us. So student debt is near and dear to a lot of our hearts, and it's an issue we have to deal with personally and professionally coming out of dental school. So I'm going to provide you with the facts to get it right first, and then we'll go through some concerns. So last year in 2016, the graduating average dental student came out with $261,000 of debt. So clearly dental students care about this issue. Over 1,800 students and ASDA members sending letters to Congress encouraging and pleading with them to do something about this issue. Just to get a perspective of who has student debt, 80% of the class of 2016 and dental students had over $100,000 in student debt. And we can see that this has been a growing issue over time. In 1990 and until now, the student debt has has quadrupled just in that short period of time, which is worrisome to us as students and new dentists coming out. All right, so I'm going to tell you a little bit about ASDA's positions, and a lot of people coming in and say, hey, what is ASDA and advocacy all about? And I tell them first, what we ask you guys to do is get educated on the issues. That's the most important thing. And then after we learn about all the issues, we can go and successfully lobby and press what we want legislatures, whether that's in the state level or Congress when we go for lobby day. We can pressure them on legislation we feel should be passed for our benefit as students and for our patients. So some of the legislation that we push would be the expansion of tax deductibility of interest on educational debt, student scholarships, and loan repayments. So what that means basically is when you come out of school, we want after we've made our salary and we're paying our debt, we'd like the debt that we're paying for student loans to be tax deductible. And at this time, there's currently a cap, which I believe is about $80,000 in annual income for those people who can get tax deductible for their loans. So we'd like to see that go up, and obviously with the reduction of student loan rates is a big thing we're pushing right now. Student loan rates, they fluctuate between 6 and 7%, and anything helps for us students. Very rarely will you see dental students default on their loans, and we feel like that should prove that we can handle what we're borrowing and should be able to pay it back in a timely rate with a decent interest rate. So the last two go hand in hand with improving access to public service loan forgiveness programs and loan forgiveness programs for tuition for dental students and residents that practice in underserved areas after graduation. So this is big because basically it's a win-win for as the members, students, and for those in the underserved areas. We're hoping that there are programs that will come out that will say if you're going to come and serve in an underserved area for a certain period of time, say 4 or 5 years, we're either going to reduce your loans or give you loan forgiveness for your efforts there. And so along with that, scholarship opportunities for dental students, which we'd like to see be increased, along with residents that practice in these underserved areas. Because for us in ASDA, it is about our student debt, but at the end of the day, we hope that while we relieve some of our student debt and the mountain that we've piled on, we can give back by doing it. And so this mutual program would be great to see pushed through in some sort of legislation. As I mentioned before, tax deductible and rebates for dentists that practice in underserved areas, that's a big thing that we push here at ASDA. And we'd also like to see compound interest stop on the loans that we take out and capping of interest rates once we graduate. So now that I've told you about our positions at ASDA, I'm going to tell you a little bit about our efforts here and some of the legislation that we've helped get through with Lobby Day and we're working on still. So HR 649, which is the Student Loan Refinancing Act, when we went in 2015, we had 40 co-sponsors in Congress, and this is a big one. Basically, the Student Loan Refinancing Act, which was introduced by Rep. Mark Pocon from Wisconsin, gives us the ability to refinance at the federal level more than once and take advantage of the direct loan and plus loans at any time during the life of their loan. So enabling us to take advantage of lower interest rates is going to help us during more favorable economic conditions. And another bill that we're looking for, piece of legislation to push, is HR 4223, which is the Post-Grad Act. And when we went to Lobby Day in 2016, there was 24 co-sponsors we had on board. And basically, the bill, the Post-Grad, stands for protecting our students by terminating graduate rates to add to the Debt Act. And what that means is the bill would allow students pursuing graduate or pre-professional degrees such as dentistry to receive federal direct subsidized loans, which is great versus what we're getting now. The next thing I'm going to touch on are barriers to care, and we've got another great infographic here that really just shows some of the lack of access that we're getting. And for those who don't know, basically barriers to care is as simple as it sounds. But the term includes people who aren't getting treatment due to one's finances or their geographic location, poor oral hygiene, literacy, amongst other things, which is important because oral health care can threaten your overall health care and in general the quality of life. So these are a few statistics we've laid out here, and it is scary to see that 180 million people aren't going to the dentist this year. You know, that's nearly half the country there, along with 50% of those over the age of 30 have some sort of gum disease. But things are being done, and $2.6 billion has been given in free or discounted dental care through programs like the ADA's Give a Kid a Smile, which is great, along with Missions of Mercy to contribute to this. But you know, the issues are still there, and the fact that 1 in 4 children, you know, under the age of 5 are having dental caries. But that's why we're here as students, to get proactive about this issue. 90% of the dental students are among ASDA, and we're here. We're going out to Lobby Day in March and doing things before that to educate ourselves on the issues. 380 of us were out there pushing along with dentists, and we'll keep doing it. So moving on, I just want to talk a little bit about the positions on barrier to care for ASDA. And you know, we're big on outreach populations and going out and serving those who are at high risk in rural and urban areas that don't get the treatment that they need. Whether that's through your school's programs, whether it's foreign or abroad or here at home in your backyard. I know at NYU, where I'm at school, we take a trip upstate, and they also do trips to Nepal and other countries with dental faculty, which is really eye-opening from the experiences that I've heard. ASDA also encourages participating in dental students who are interested in public health or that oral field, and going out and learning and making an impact on your own. So some initiatives that we support in ASDA are improving overall health with special needs patients. And when I was going through and interviewing at schools, one place I saw this really well was at Pitt, and I was really impressed with their special needs clinic and the anesthesiology background that their students were getting, and it was just a really impressive example to show how us as students can make a difference in not only patients' lives, but those who aren't getting the care that they might need. So as for the legislation for barriers to care, HR 539 is the Action for Dental Health Act, and that was a big one. It had 113 co-sponsors since Lobby Day in 2015. A lot of people have written out for this, and Rep. Kelly and actually Representative Simpson in the House reintroduced the bill, and he is one of 4 dentists in Congress. It shares the same name as the initiative of the ADA, and this initiative has 3 basic principles that we hope to accomplish in eliminating barriers to care, and that's to reduce the number of people visiting the ER for dental pain. As we know, that's an issue, and we'd like to get them in preventative measures before they get to that point. And supporting charitable organizations like the Give a Kid a Smile and Mission for Mercy, which gives so many you know, free and discounted dental work to people in need. And lastly, enabling residents to have drinking water with fluoride is a big one of this legislation. So we hope that we can push these things through as we move on to Lobby Day and educate ourselves on the issues. And I'm going to turn it back over to Emma. Thank you.
Okay, so the last topic that we wanted to talk about today is water fluoridation. And this seems like common sense for probably all of you dental students, but believe it or not, there's quite a few communities that have pushed back against their community water fluoridation. Obvious to us, it prevents tooth decay, it prevents against cavities, it's safe and effective, it's natural, and it saves money. And for every $1 that a community invests in it, they estimate that they save $38 in dental care costs. So it's really one of the best public health measures that the United States has ever taken. Water fluoridation is regulated on a community-by-community basis. So each municipality can decide whether or not they want to fluoridate their water. And there's oftentimes groups who say that fluoridation is poisonous, it's toxic, it's people trying to, like it's the communists trying to poison us. There's crazy things that if you just Google fluoridation, you'll find many people who believe these things and often try to raise awareness about the evils of fluoridation in their communities and stop their communities from having water fluoridation. However, ASDA supports that it's scientifically proven as safe and effective and is one of the biggest preventers of dental decay. It's also recommended by the U.S. Public Health Service. So what can you do on the point of fluoridation? It's kind of a hard topic because it feels like it should be easy and that like obviously fluoridation is good for you, but people who believe it's not are hard to convince that it is a good thing. So ASDA continues to update members in communities that are facing barriers to their water fluoridation, or if there's groups in a certain community that is against fluoridation, ASDA updates its members in those communities, as well as provides information on it in our monthly advocacy brief. ASDA also has written about how to combat the misinformation on water fluoridation, and there's information on it on our website. So we just really ask that you stay informed. Obviously, you know the benefits of fluoridation, but we encourage students to be advocates in their own community because, like I said, it's a community-by-community basis on fluoridation. So just make sure that you're staying informed on that. And I just wanted to update you on our 2017 Lobby Day initiatives. In 2017, HR 2422, the Action for Dental Health Act, was introduced. It was introduced after our Lobby Day this year. Since then, 88 engage letters have been sent. So through our website, ASDA Engage, 88 students have sent letters to their congressmen, and we hope to see that number rise. This is the same bill that Stephen talked about earlier, just this year's new version of it. And then as far as dental student debt goes, we spoke about HR 1614, the Student Loan Refinancing Act, at this year's Lobby Day. And since Lobby Day, we've had 14 co-sponsors sign on, and 385 engage letters have been sent. So we'd like to see that number continue to rise. So we'll talk a little bit about what our next steps are as far as what you can do to become an advocate in your community.
Yeah, and so the first thing to do is kind of determine what your chapter's advocacy strengths are or are not, and make a plan to improve those advocacy efforts. And ASDA actually has a pretty neat track program module set up online. That's the link right there. And if you go to asdanet.org, you can find it through Get Involved, and then the Advocate tab. And it's just a little module that asks you a few questions. You know, did you hold an advocacy event in the last month? Did you attend National Lobby Day? Just a few yes or no questions to kind of gauge where your chapter's at. And then it has a lot of good resources and ideas for things to do at your school, ways to get involved with your state association, or, you know, how to send people to state or national lobby days.
All right, and lastly, we just like to update you on Advocacy Month, which is in November, and there's a lot of social media challenges and amongst Engage efforts to get involved, and this is when you can reach out to your chapters or even before, letting them know this is a big month for us and as the national, and at your local chapters, and we can make it our goal to reach out for advocacy in November. And lastly, there will be other webinars, and including a range of topics, 4 to 5 throughout the year. And if you're looking to stay updated between now and then, which we'll give you updates on, Advocacy Brief, which comes out, is ASDA's monthly newsletter, and it'll devote specifically towards legislation and issues pertaining to what we've talked about tonight. So if you'd like to stay updated, there's that. And my personal favorite, National Student Lobby Day, which will be paired with 88 dentists, just as it was last year for the first time, is a great way to enact all the policies and educational things that you've learned through ASDA to show your care and for your patients and yourself through all the issues we talked about tonight. So we thank you very much.
So at this time, we're going to open up the panel to questions. The first question that was submitted to the panel: what were the issues y'all lobbied for in 2017 at the ADA Dentist and Student Lobby Day? Kyle.
So I'll go ahead and just tell you guys, we did work with student debt, and that was a neat experience being with a dentist because it was my first lobby day. And being with paired with dentists as dental students, I think it gives another, I guess, picture to the congressman or the congresswoman that you're addressing, saying, you know, this isn't just coming from students who care about the amount of money that they're paying. It comes from the dentists who are still working in their 40 or 50, paying off their debts, and they're looking for ways to not just for themselves, but to be able to give back, like the things that I've mentioned before, to their underserved communities. And if it can help us get the mountains of debt we've accumulated off our back, in the meantime, it'd be great for all of us to do something like that. So that's something that we pushed with the acts that I talked about, and Emma and Kyle can talk on other issues we lobbied for.
So we also talked with the dentist about healthcare reform. This was obviously a hot topic as a healthcare bill was kind of imminent in coming. There wasn't one at the time, but we reminded legislators about dental issues and what we hope that they would like. We hope that they would include as far as including access to care and insurance benefits for dentistry. In whatever healthcare bill is passed. And then Kyle, did you want to talk about McCarran Ferguson?
Yeah, so McCarran Ferguson was a bill that we had been trying to get repealed. So basically, insurance companies do not have to abide by the same antitrust laws that dentists do. So dentists can't go down the street and just talk about what they're charging and stuff like that. But the insurance companies basically can. And that was pretty neat because that had just passed. I believe the number was around someone correct me if I'm wrong, but like 417 to 7, 412 to 7, something like that in the House the week before that we actually went. Haven't heard much about it moving in the Senate, but I'm sure we'll be looking into that as we move on. So,
excellent. Thank you all. The next question is, will these slides be available? And
yes. The presentation's being recorded, and it will be up on the ASDA website next week for you to view many more times over and over again.
Thank you. Next question. This one pertained to the mid-level providers. The question was, what is ASDA's stance on mid-level providers being able to perform only on non-adult teeth, e.g. pediatrics? So I'll just jump in on that one. So currently, ASDA is against that. We don't discriminate whether it's a pediatric patient or an adult patient. We stand firmly behind the belief that only a dentist that is trained in treatment planning, diagnosis, and performing procedures should actually be performing irreversible procedures. So again, we're all for hygienists being able to do sealants and preventative for pediatric patients, but when it comes to irreversible procedures, we limit that to trained dentists. The next question rolling in is, can pre-dental students attend the lobby day?
Yes, they can. I actually met a pre-dental student, and he was there, and props to them and you guys if you want to get out that early. I came out as a first year, and Kyle always jokes with me about being the underdog or the rookie, but that's a great experience even as a first year dental student or as a pre-dental student to really understand the issues at hand and see them get enacted. I think a lot of people coming into dental school are so worried about school and lab and all of the things that come with it, but about things that they want to fight for, and they don't know really how to fight for them. But lobby day is the overarching end of the year way where we go out fighting for what we care about, and whether that's pre-dental students or fourth years, it's a great way to get involved.
And I think to touch on that too, just being aware of what is going on, because I didn't really know about all these issues until I got into dental school, and so it's a good way to kind of get a head start on that. So definitely.
Excellent. Thank you all. The next question, what is a community dental health coordinator?
So I can touch on that a little bit. Basically, it is a person in the community that helps people get to the dentist. So there's a lot of different things that can look like. That can be a person who helps people who don't have rides get to the dentist, find a ride. It can help them find childcare if they are supposed to be taking care of their kids, and that's the reason they can't get to the dentist. One of the biggest things that I like about what they do is they often prevent emergency room visits. So often they're a go-to person, kind of like what a social worker would be, where people say, this is my problem, where do I go? And for tooth pain, a lot of times people go to the emergency room, and emergency room visits cost the community a ton of money, especially if those are Medicaid patients. And often they pretty much can't do anything for tooth pain. They'll maybe give them some pain medication, they might give them antibiotics, they might give them things that really don't work at all for whatever their problem is. And if people were to go to the dentist first, it would, number one, save the government money on getting those people the correct care at the correct cost, but more importantly, those people would be able to actually get their needs taken care of. If it's a tooth that needs to come out, that tooth could come out that day instead of going to emergency room and then prolonging it and trying to find a dentist after that. So the community dental health coordinator is a person who is able to regulate that in a community, and sometimes they can be people who have other jobs. So oftentimes, like a social worker will be trained on dental issues and will be able to provide that role of community dental health coordinator. Sometimes they are their own standing person, and you might hear of those also lumped into the mid-level provider. I just want to make it clear that that's separate from what I was talking about today. ASDA is not against CDHC's community dental health coordinators. They do promote those. So just to clarify.
And if I may, I just want to elaborate on that just a smidge. So this is, as she said, kind of like a social worker. And so it's a program that any individual can take, and oftentimes that would be a dental assistant or a dental hygienist that's looking to expand their functionality in the office. One of the other big functions that they do is connect, particularly in lower socioeconomic areas, connect individuals that have Medicaid or Medicare benefits and connect them with a dentist that can actually be able to provide them care. A lot of individuals often find or believe that there aren't Medicaid or Medicare providers within their community, and that's one of the functionalities of this individual. So thank you, Emma, for that excellent answer. The next question, for young chapters, do you have any ideas of how to get funding to send people to Lobby Day and fund lunch and learns for events that are advocacy related, particularly during Advocacy Month?
So one big thing we do at Colorado is get involved with the state association in your local society. I think we had 2 or 3 events last year where they came down and they offered to buy lunch, and sometimes it's only pizza, but I mean that'll still get people in the door, and just talk about what's going on. They talked about a couple times about what's going on at the state level, some big changes in licensure in Colorado, and so they were really helpful in getting stuff organized and working with them. And I mean, sometimes it's difficult to get a hold of them, but if you do have further questions on how to, feel free to reach out to any of us after this too. I know our info was posted at the beginning, so.
I would also throw in, feel free to ask vendors, particularly vendors that you are well acquainted with, and personal dentists that you're well acquainted with, whether it's faculty or dentists that are strong in the community and support you at school. We've had a lot of individuals at our school that have been sponsored by vendors and private dentists to go to these events. The next question, When speaking with my congressman, they always share that as a dentist, I'll make enough money to pay back my loans. How would you address that?
You know, that's a great question, and I had the same issue, I guess, walking into the congressman office, and you know, everybody comes to these people and they ask them for something, and I think going to the congressman and not framing it in a way of yourself, but as we've said before, that we'd love to help the community, and think about all the people that would love to go and work in underserved areas right after school, but with you know, even at private institutions, you know, the debt can reach $500,000 or more after school, and you just can't afford to do that in some cases right after school or in those situations. So I think maybe addressing it in a concern of your patients and people that don't have the care that they need, and you guys hoping to reach out to those people, but also dealing with your student debt at that time, which is real, would be a better way than saying, hey, you know, we're going to make money and we'd like to make more and have less debt.
Excellent. Next question. What are the current alternatives to clinical licensure exams?
So there's a couple of different alternatives out there right now. One of the ones which you might have seen in our presentation that we are pushing for is what's called the ASCE, the Objective Structured Clinical Examination. Right now it's used in Canada. It's also in Minnesota, and I think Kyle said it's accepted in Colorado as well. And other states are pushing for it. So what that is basically a written examination that you see radiographs, you see models, you see patient cases, and it tests your clinical decision making and treatment planning skills. So one thing that the patient-based exams don't test is how you're able to treatment plan, how you're able to look at a case and problem solve, kind of what your decision making is. And the ASCII does test that. It's actually a pretty difficult exam as far as that goes because it's something that we're not necessarily used to, but it is a great way to test how good of a dentist you'll be by your decision making and your ethics. And right now the ADA is developing a United States ASCII. It's called the DL ASCII, Dental Licensure ASCII, and that I believe is going to be out for a pilot exam in 2019. And ready for use in 2020. So the ADA is pushing for states to be able to accept that as a pathway to licensure. The other, I guess, non-patient-based, although it still uses patients, format is that portfolio version. So you're still using patients, but it's in your daily clinical setting. You basically make a portfolio of things that you've done in dental school. So that's also part of ASDA's ideal licensure exam. And that's currently administered and accepted in California. Correct me if I'm wrong. Oh, and then the final one is in New York. I think that's the only state you are allowed to do a residency in the state as a pathway to licensure. So if you complete a 1-year residency, you are able to be a licensed dentist in that state. And I believe I also just got a notification that it's also allowed in California, Kentucky, and Colorado, if I'm correct.
And Washington.
Next question. What conversations can be held on the state level to help transform licensure?
Yeah, this is a tough one because, until everything is like a universal exam, it's a state's issue. And so just working with the state dental associations to get specific policies passed. And I know we had some really good ASDA leaders in the last few years at Colorado, and that's really what turned the tide at Colorado, or in the state, because 4 or 5 years ago it was only a reb and credit state, and then now it's just about anything. If you do a portfolio in California, you can come to Colorado. If you do a PGY1 anywhere, you can go to Colorado, or you can take one of the standard exams. So just working with your state dental associations and getting the conversation going, and working on different pathways. So.
And I'll jump in. The other place that is a good place to look at is your dental examining board. So that's people who are appointed by your governor to basically regulate licensure, and they also deal with ethical issues of dentists. But they're the ones that make the recommendation to change licensure in your state. So it's a good idea to work through your state dental association, but you'll probably also get involved with your dental examining board in your state if you're working to change licensure.
Yes. The next question, how do I know if there is mid-level legislation in my state?
Correct me if I'm wrong, but I believe that ASDA keeps tabs on mid-level provider legislation state by state. We're always taking a look at where things are being introduced. And they'll keep you updated via the advocacy brief. So if there is legislation being introduced, it will be there, that monthly newsletter that comes out. And your school's legislative liaison will most likely know, the district coordinator should know. So keep in touch with the legislative liaison at your state, keep in touch with the State Dental Association, and make sure you read that advocacy brief.
There's also a section on ASDA Engage where you can look out for specific state-based action alerts. So in case the brief hasn't come out yet and you're dying to find out immediately, that is where you should go. The next question, what would you say would be a better solution to mid-level providers? Many states have vast area where there's limited access to dental care, and mid-levels could help address this. So I'll jump in on that because I've actually done a couple presentations on access to care issues. So some of the major ways that we can resolve some of these access to care barriers, particularly in the more rural or socioeconomically disadvantaged areas, is by working with our state legislatures and our state associations to increase Medicaid and Medicare reimbursement rates. I believe it was Georgia that saw that when their Medicaid reimbursement rates were increased, there was a drastic increase in enrollment of dentists in those programs, and we saw increased access to care for Medicaid recipients. Another way is to encourage loan repayment programs, both at the state level and the federal level. These programs are designed to encourage individuals to go out to more rural areas in, in lieu of working in maybe a metropolitan area, they will be compensated with loan repayment. And I believe it's the Health Corps Scholarship Program that right now does a three-year program, and they will repay up to $120,000 in student loans. Another way is preventative. We're looking to increase oral health literacy and via school sealant programs. So, I mean, there's a lot of different opportunities to address these access to care barriers without jeopardizing the quality of care that we're giving to our patients. Oh, yes. And one little interesting tidbit about the mid-level practitioners, particularly in Minnesota, the advanced dental therapists out there, although the program was implemented, of course, with the greatest of intentions, what the studies have shown for the graduating people coming out of those programs is that the majority of them are not actually going to the rural areas. They're flocking to metropolitan areas. The one caveat being, though, that they're still serving in underserved areas in those, but they're still within the metropolitan areas, and they're not addressing all of the health health professional shortage areas in the more rural area, which are generally the more problematic areas to get dentists out to. There's always an oversaturation in metropolitan areas, so that's generally not the biggest problem. And that actually concludes our questions for the evening. So I really want to thank all of y'all for coming out this evening, getting a little more informed on the topics. And this is just basically an introduction to advocacy and an introduction to what you can do and bring back to your own schools and your own states. So I really encourage y'all to reach out to your dental associations if you haven't already. Reach out to us, to Kyle, Emma, Stephen, myself. I will respond to any emails and I will get you answers for any questions that you have. I will help you in any way that I possibly can when it comes to setting up events at your school, finding funding, whatever y'all have questions about, whatever you need help with, we're here to help and support y'all and promote advocacy. So thank y'all so much for being on this call this evening. And thank you to our panelists for answering everything.
Thanks, guys.
Yeah. Oh, yes. One last thing. Come to NLC. That's going to be in November. And if you have a super strong passion for advocacy, we would highly encourage y'all to look into applying to this council. It is an amazing opportunity, and I would highly suggest it. So thank y'all very much, and Vogel out.
Have a good night, everyone.